Dr. Brooks. Wanted to sit down and chit chat a little bit about healthcare insurance, our system, all that fun stuff. I actually read a really good article that was published end of December about sort of our healthcare system and what's happening and the frustration that I think I hear from families. I certainly know that my front desk hears it when people call in to schedule appointments. So the good news is everybody has options, right? And I think most of my families value optimizing their health, staying healthy, and quite frankly, they're open to lifestyle changes. Our current medical model is very much sickness-based, correct? So when we go to the doctor, we tell them our symptoms, they prescribe us a medication perhaps, or they give us a diagnosis in the case of the children in my practice. So the two doctors actually wrote this article about what's health worth to you. And I found it pretty interesting. I think their perspective was everybody has excuses. I don't have time to do this. I don't want to make the changes because it's too expensive. And I'm talking more like diet changes, or I have insurance and I want to use insurance. I have moms calling, I know, and the front desk tells me that the dad doesn't want them to seek care from anyone who doesn't take insurance. And the truth is that insurance doesn't cover preventative medicine many times in the aspects that a lot of us are out there helping. It doesn't worry about early intervention. It doesn't worry about ultimate health, right? We have wonderful programs like early childhood intervention that are funded until the age of 3, so parents can get services, therapy, occupational speech therapy, things like that. But we've seen how sick people are in general and how our kids are getting sicker by generation. I know for my practice, the kids that I see are coming in younger and younger. And I'm so thankful for that. I'm so thankful. And I hope those of you that are out there in the medical field or doing functional medicine, regardless of what your definitions are of that or how you're helping, I hope that you're also seeing that. We live in a culture that expects healthcare to be cheap. We live in a culture that we expect our healthcare to be paid for by our insurance companies. We want a solution. We want it to be easy. We want it to be fast. And we don't want it to require much of us. And I think that it's discouraging, I think, for me to think, because I know that the true path to health, not only in my own life, but in the lives of many, many families I've worked with over the decade plus that I've been helping kiddos, that I'm encouraged by the way that we're doing things differently now versus how we were doing them 30 years ago. I have seen private health insurance let many of you down. It's let me down. I've seen mainstream medical education be regurgitated to parents improperly, taken out of context, and it makes me sad. So I'm always thankful when any families come into our practice and we can nurture you and take care of you and educate you the way that you should be, right? How to keep your kiddos well. And for me, it's a responsibility. It's not just about your child, it's about your whole family. If we're looking at how to help your environment, we're talking about benefiting your whole family. And that's a blessing, right? So it's really about taking care of everything. When I value health, not just of my patient, but of the environment that they are in, and that includes the entire family. I always feel like all of you benefit, the whole family benefits when somebody's under care. You know, my top priority is to maintain health for as long as possible and to maintain the results as long as possible. And sometimes it's, what are you willing to do as an investment in your health? Not just you, but in your child's health. And it isn't always easy. And it's not it's not as easy as, plug and play, right? We're asking to change your diet. We're taking supplements. In some cases, I've had some kids that have had a laundry list of allergies, and these kids are older, 8, 9, 10, and we're just now finding out they have allergies to this stuff. It's kind of crazy to me, that are major contributions to why they ended up in my office to begin with, which is a travesty, because guess what? Health insurance covers allergy testing. So why are we finding out at 8 or 9, right? That's the portion of healthcare that I think is somewhat failing, because there are some things covered by insurance that you guys can get paid for sure. The aspects of getting healthy, how we cultivate health, how we raise our children, how we balance our lives is sort of underneath the mask of imbalance that we all sort of live, right? I think that clean living, getting toxin free as we can, reducing stress in the home, really having somebody understand their whole system in healing, right? Because for me, my parents have to understand what that looks like in their kiddo, because my 3-year-old can't do it themselves. They're relying on their parents, right? So I do understand your frustration, but I do want you to know that the insurance model constrains those of us out there trying to get in to help repair the issues early, pre-diagnosis, pre-problem, sort of, quote unquote, right? We're trying to do our best to guide you with every available resource. I know I am. And healthcare doesn't always come from the pharmacy. Certainly there are those things that do, and they have their place. But an illness a lot of times is not a sudden event. A lot of you will learn when you're in our practice about sort of where it started and where the imbalances over time have kind of cultivated into this problem that you now can put your finger on and point to, right? So I think you need to understand there's a balance. There is a lot of things that are covered by insurance, so we maximize that. There's testing that's covered, but when you're thinking about the frustration or the why is, it's not that we don't want to help you. We as a medical community, it's not that we don't want to help you. It's that the insurance companies aren't helping us help you. So we have no choice. We don't take insurance because I can speak for myself. I don't want somebody telling me how much time I can spend with you. I don't want someone telling me I'm gonna reimburse you for 10 minutes of time with that patient. I see patients that have seen other physicians that take insurance because they're not getting well. And I don't think that's a lack of knowledge or a lack of caring by the other physicians. It's a lack of time. It's a lack of explanation. It's a lack of education. My patients are well educated. We spend lots of time with them, and they understand why we're doing what we're doing and the method to our madness and what exactly is going on with their kiddo, right? It's not just an investment in money that you're making when you see somebody who doesn't take insurance. And it's an investment in your future. It's an investment in your family. It's an investment in your health. It's an investment in educating yourself. How do I help educate you to help your family? It's not a dictatorship. You're learning a ton about the things that got you to where you're at, and the things that are going on now, and the things to help you stay healthy long term. I don't want my kids coming back into the practice in 10 years regressing. That's not my goal. My goal is to dot all my I's and cross all my T's and send you off with all the knowledge that you need. When to call me if something happens, but what to do to keep that homeostasis, right, of where we get. My job is to support you toward a life of optimal health. That's my job. My job is to do as much good as I can with any given kiddo, and that looks different for all of them. And that's part of why I love my job, because it's challenging, right? But there's not a script, there's not a piece of paper I can check, do this, and everybody gets that same piece of paper. It doesn't work like that. That's also the beauty about functional medicine. When you're seeing a practitioner, there's an art and there's a science, and if they're doing their job right, and many are, that's what gets us well. You know, I've had medical insurance on and off through the years, and I use it for what it's good for, and I pay somebody that's a functional medicine person. I don't even take care of myself. I pay somebody to take care of me, and I have a whole team of people that take care of me, because I have to be well to take care of you, right? So I understand the frustration, but I do want you to know, as we go into 2020, I never thought I'd still be here in the year 2020 talking to people about what their health is worth, because I would have hoped for more change by now. And the truth is, there just isn't enough, and it's not happening fast enough. And I know many of you are just finding this type of philosophy and this type of care now. And maybe you're the parents, and maybe you've been sick for 30 years. And I hope nothing but healing and positive health outcomes for you. If you have a child, I would, if you have insurance, you can opt into some health savings accounts, to some HSAs, FSAs, things like that are really well worth the investment, both from a tax perspective, which you can talk to your CPA or your tax person about that. And it also gives you the freedom to use that money however you want. So if you want to see a functional medicine person, that's how you spend your money. That's how I've always done it. I've always had a health savings account that I use however I want. And a lot of them now, you can buy supplements with them. You can pay for your out-of-pocket testing with them. You can pay whatever doctor you're seeing with them. And it's sort of, everybody's happy. It's sort of a way to use your insurance, but you get to be the boss of it, right? And you get to see who you want. And I think that the power to choose, the power to be healthy, the power to get your family well is a big responsibility. And I hope that you make those decisions, that your health is worth it and your family is worth it, and find someone who's really fantastic. So anyway, so that's really all I have. I saw this and really kind of wanted to talk about it now that we're getting into the year, which is crazy. So anyway, if you need our help, give us a call. Our phone number is on our Facebook page. Go ahead and like us. Forward our videos and our information. The whole goal of our Facebook page is really to educate as many people as we can about ways to help the kiddos out there, because one of us can't do it all, right? It's kind of takes a village. So anyway, Happy New Year, everyone, and I'll talk to you soon. Thanks. Bye.